on in. Do you want to take a seat up here? Dad, do you want to sit there? And then we're going to use something called a Smileyscope VR headset. Have you seen one of those before?
Yeah.
You have? That's exciting. The Smileyscope is a virtual reality headset. As a child is faced with quite a daunting medical procedure due to happen to them, we can transport them to a different world. They're putting on essentially some diver's goggles and going under the ocean and watching some fish swimming around them. So Barney, what can you see now?
Lots of seaweed.
Seaweed?
And lots of fish now.
Hello, I'm Sam. I'm just going to be doing your blood test today.
As the procedure happens, the fish move to the area of the body where the procedure is going to happen. So they'll feel a gentle nibble from the fish, which ties in with the time that the procedure is happening to them, such as a blood test.
That's all done.
More often than not, the children are now not noticing that the procedure is happening. They feel so much more calm and relaxed as the procedure happens. Well done, Barney. So how did that make you feel?
Calm.
It made you feel calm. Did you enjoy that?
Yeah.
Yeah. We see children's anxiety levels come down. We're using it a lot during procedures, so perhaps if a child is having a blood test or a cannula, or perhaps post-op if they've got a dressing that needs removing, then it can be used at that time as well.
Thinking of Oscar is a children's charity. It was set up following the sudden and very unexpected death of our son Oscar, who is 16 months old. Our mission is to bring the future of healthcare to children, so we fund latest technologies, anything to really kind of help children whilst they're in hospital. Smileyscope was specifically designed with children in mind. A lot of the technologies are specifically designed for adults and then they're scaled down for children, and that's not really necessarily the best way to do it. Children make up 25% of the population, but they're 100% of the future. Currently we have supplied headsets to 4 separate hospitals across the UK. There are many different uses for the headset, and we've seen the hospital use them in a number of different ways.
Hi Ollie, how are you? Good, I'm good, thank you. My name is Sonia. I'm one of the place specialists here and I work in the radiology department. Have you ever had an MRI scan before?
No.
Smileyscope has incredibly positive impact for children and their families who are coming in for awake MRI. You come on to here. Right, get yourself really nice and comfortable. Which adventure one that you'd like? So there's bakery, it's all about donuts, one of my favourites.
That's your adventure.
Right, I'm going to pop this on your head. Many of our patients do find MRI machines quite daunting, a daunting experience. They're very, very loud, they're very noisy. You have to lie very still. You're in an enclosed space, in a tunnel. Okay, I'm going to press the button on the front, and then the adventure will begin.
I'm Poggles the Penguin, and today we're going to go on a dessert-making adventure.
MRI scans can take anything from 10 minutes up to way over an hour. The Smileyscope really helps us to assess whether a child is suitable to have their MRI scan awake. So this is a really good way to actually put them through the experience without, like I say, being in real time in the actual scanner. Scanning patients awake has many, many benefits. There's the benefits to the patient where it reduces risk because they're not having a general anaesthetic. It reduces the amount of time they have to spend in hospital. They'll get their scan appointment quicker because there's a shorter wait time for an awake scan than a scan under general anaesthetic. There's also benefits to the trust because it saves time and it saves money. You can scan more children on an awake list than you can when you have to give them an anaesthetic. So it's hugely beneficial to all the service users and providers. Do it nice and slowly because it's very bright out here when you've been in there. Well done, how was that?
It was good.
I think you're going to need probably 7 pictures, but those are some of the noises that you're going to hear when you're in the camera.
Okay.
Okay, now you've done that, how are you feeling about having your MRI scan?
A lot better, I feel more relaxed.
That's perfect. Right, let's get you to the scan room.
Thank you.
Okay.
Smileyscope can have such an impact on children that it can not only stop a lifelong fear of coming into hospital, but it really helps the practitioner, the clinicians, to be able to do what they need to do, see more patients and make the experience as best as it possibly can be.